I'm Joy. Today we are going to talk about evidence-based nursing, analysis on the nursing care of diabetes patients. About their speakers are Millie, Crystal, Jay, Joy, May, and Snowy. This is our contents. There are 4 parts. The number 1, cases introduction. The number 2, literature analysis and application. The number 3, application challenges and suggests. Number 4, influence of literature research results on nursing staff. This is first case. Cases introduction. Next is an introduction video about Miss Lee's case, including medical history, physical examination, auxiliary examination, and the basis of diagnosing type 2 diabetes. Okay, let's watch this video. The following is a clinical application of my team members to explain the case and the literature. Thank you.
Hello, I'm Snowy. Now let's start the second part, literature's analysis and application. By reading these 2 literatures, the effect of nurse-led multidisciplinary team management on glycosylated hemoglobin, quality of life, hospitalization, and help-seeking behavior of people with diabetes mellitus. The second one, 2019 Clinical Practice Guidelines for Type 2 Diabetes mellitus in Korea. For the first literature, would it be possible to utilize the above literature in care management of patient in Mr. Lee's case study? Why? How? Support answer by citing 2 updated literatures. The answer is yes, it is possible to use it. And why? The reason includes 2 points. For the first one, the multidisciplinary team management led by community nurse in the literature could provide more comprehensive, multi-level and professional interventions on the basis of original nurse, improve blood glucose control of Mr. Lee's case, reduce the hospitalization frequency of Mr. Lee's, and help reasonable things help to improve the quality of life of the diabetic patient like Mr. Lee. According to the context of the case, Mr. Lee is a patient diagnosed as type 2 diabetes due to the increase of blood glucose for more than 5 years. and the poor blood glucose control in the past months, which indicated that Mr. Lee's blood glucose management and the nursing intervention and education measures he received after discharge before were insufficient, leading to his poor blood glucose control and remitted to hospital. For patients with type 2 diabetes, nurse-led management is very important, especially the case management after discharge, and the nursing intervention led by community nursing plays a significant role. The multidisciplinary team management led by community nursing is more comprehensive and professional. According to Huang and Wang and other researchers in 2015 and 2016, the use of multidisciplinary diabetes care team that provides patients with highly individualized care can improve patient outcomes and reduce overall cost. Besides, Arnold and other researchers in 2016, a multidisciplinary diabetes care team represents a clinical program of excellence that improves the processes of care. And for the second reason, the literature also proposes three main nursing intervention models of nursing-led multidisciplinary team management, which can be used in the case of Mr. Lee. According to research, nursing education intervention in diabetes provided by a primary care nurse with reinforcement session together with family support can achieve reductions in glycated hemoglobin, faster blood glucose, and so on. And how to use it? It includes two tips. The first tip, based on the regular group education and monthly meetings organized by nurses in the literature, and in combination with Mr. Lee's actual condition, a special diabetic conference theme was developed for Mr. Lee and similar diabetic patients. And the conference theme is a one-month change, comprehensive and easy to understand. According to American Association of Diabetes Educators in 2018, the session contents will include basic knowledge of diabetes, healthy eating, physical activity, self-monitoring, blood glucose, medication, risk reduction, problem solving, and effective coping. The second tip is the booklets mentioned in the literature were distributed to Mr. Lee. The second tip of how to use it is the bookletters mentioned in the literature were also distributed to Mr. Lee as guidelines for self-care. The rest contents of the bookletters is a self-monitoring workbook for diabetics, recording their daily intake, activity, and blood glucose. And researchers also wrote that incorporating diabetes knowledge booklets into diabetes education can make the healthy education work standardized, regular, and institutionalized, and at the same time beautify the healthy education managed work and promote the healthy development of the healthy education work.
Why use the clinic practice guideline to nursing practice of diabetic patients? Diabetes is a global health problem of both developed or developing countries. Clinic practice guidelines have shown that vascular complications can be reduced through strict control of blood glucose and blood pressure, that vascular disease can be prevented on large scale through changes in the glycemic and the use of antiplatelet agents, and that early control of blood closure has a long-term impact on musculoskeletal complications. How to do in terms of drugs. For the diabetes patients, upon admission, a comprehensive evaluation of the patient's disease history, evaluation of disease, self-management ability, dietary habits, weight, and various laboratory examination indicators can be made of formulate and individualized treatment plan. The choice of drugs should be determined according to the specific efficacy of the drugs and the screening of adverse reactions. In terms of blood closure monitoring, in this case, the patient had a history of diabetes for 5 years and had been taking oral hypoglycemic drugs to control blood closure. The result of insulin test was normal and insulin treatment was not used. Therefore, the patient should timely report and results for lifestyle improvement and drug treatment for self-blood closure monitoring, and conduct best male mode of treat patients with type 2 diabetes so as improve blood closure control and reduce the risk of blood closure. In terms of weight control, the BMI of the patient was severely excessive. According to the guidelines, staff should provide structured education to patients, followed by regular intensive examinations. At the same time, there should begin treatment, including drug and multitions therapy, weight control, physical activities, and smoking and alcohol cessation.
Okay, this is my part. Application challenges and suggestions. Next, I will show you this. For the first articles, I think we will have the next challenges. First, lack of research, evidence on diabetes, education, and diabetes care. Diabetes educator, lack of the qualification and certification of normal uniform standards. Second, lack of team management in the real sense. Diabetes education is still mainly provided by endocrinological system nurse, rarely attended by nutritionist, exercise therapist, and other related disciplines. The education content is not standardized, lack of systematization, coherence, and repeatability, and it is difficult to achieve individual education due to limitation of nursing resource. Third, lack of quality evaluation system for diabetes education and management, and often neglect behavior, psychological and social intervention patients. Lack of high quality evidence-based medicine and other new ideas for the development of specialized diabetes care. Fourth, the hospital has not established the standard of blood glucose management for the whole hospital, and the non-endocrine medical staff has not fully grasped the knowledge of the diabetes education management and are not aware of the new concept, development, and standards of diabetes treatment. Therefore, they cannot provide standardized, safety, high-quality diabetes care and management for patients with hypoglycemia, in the hospital. We have these suggestions. First, its application guide. Guide although has very high scientific and authoritative nature, but in clinical application cannot take it on dogmatic. Evidence is important, but it's only a factor of clinical decision. Doctors and nurses are faced with a patient rather than groups. Therefore, when the application guide must also consider reading and the conditions of each patient, such as the age of the patient, level of education, and complications. If disabled or even the patient's sense of value or orientation. When we are in the application and combined with natural conditions, diet and lifestyle, culture and education background difference. Therefore, different patients may have different treatment strategies and objectives. Second, the guidelines give a little introduction to the pathogens and do not describe too much in terms of prevalence treated of diabetes, diagnosis and classification management, drug therapy, special critical hypoglycemia management, acute complications, chronic complications, and metabolic syndrome, comprehensive control objective preparation, and intensive follow-up program. Third, no introduction and summary of different types, periods, conditions, ages, special conditions, and psychological abnormalities were provided. Okay, that's all.
Hi guys, I'm Crystal, and this is part 4, Influence of Literature Research Results on Nursing Staff. The main meaning of this diabetes care intervention and diabetes clinical practice guide for the help of nursing staff. Okay, let's see that. The first one is improve the initiative of health education of nurses. Through the study of the instruction manual, patients can understand the relevant professional knowledge, and through active demonstration and communication, nurses can increase the ability of health care education for patients. Next is the popularization rate and awareness rate of health education have been improved. Because the guide explains the knowledge of the disease and matters needing attention and others so on. So the patients know the knowledge about the disease, so they can know why you do that, why I do that, and how to do. So this is explanation, and the patients can improve the knowledge about the disease. And next, it is conducive to nurse-patient communication and save nurses time. The nurse used the manual to explain the patients systematically, which improved the patient's peers. Before, the most patients think that nurses only know how to give injection for the patients and to change the medicine for patients. But through this guide, patients can understand why the nurse do this, and they know why the nurse give this the intervention and how to do. The patients need to have a good cooperation for the nurses. So for the nurses' healthy education, can be improved. And the trust of nurses and the understanding of the purpose of nursing intervention have narrowed the nurses-patient relationship. It means that the relation between the nurses and patients can be close, and manual guidelines for older patients can help with memory and save nurses time. For the diabetes, most the patients are elder, so through this the explanation of nurses and the study of guidelines, the relevant knowledge care can be quickly learned and save the time of health education of nurses. Through the guidelines, the patient can be improve the knowledge about the diabetes, and they can use the guidelines help them to remember the knowledge, and they want to it's easy for them to understand the knowledge and to do how to have a good occupation for the nursing. Okay, the last one. Effective nursing interventions can increase nurses' sense of accomplishment, better serve patients, and better delight themselves. The most important, the technique, operation, and theoretical knowledge of nurses can be regulated through nursing intervention and guidance. So, in conclusion, these two research results are worth promoting in clinical through continuous improvement. So this is a good thing. This is a reference. About our content so much, so if you have other ideas want to share with us, welcome to contact us. Thank you everybody. Bye bye.
Here come the X share our discussion.